everyone. I would like to welcome all of my colleagues to this first virtual employee recognition event. Today, we honor those who have served from 5 to 50 years. This degree of activity and loyalty of these men and women is what has made us what we are today. This is why we graduate over 1,000 healthcare professionals a year, why we do over $100 million in research, and why we do groundbreaking clinical care. This degree of commitment is unique, and it shows why we have advanced and why we remain one of Memphis's best workplaces and the largest healthcare educator in the state. The commitment to the Health Science Center shown by everyone during the COVID pandemic is what has allowed us to continue to do our research, to do our clinical care, to do our public service, and to graduate our healthcare professionals on time. From Memphis to Nashville to Chattanooga and on to Knoxville, Health Science Center employees have made us a statewide institution. Thank you. We are UTHSC.
Hi, I'm Ken Brown, Executive Vice Chancellor and Chief Operations Officer of the University of Tennessee Health Science Center. Each year we honor and celebrate our employees who have over 5 years of service at the University of Tennessee Health Science Center. We acknowledge and truly appreciate your years of dedication and service. This year, our program is adapted for a safe virtual experience given the realities of our time. Without a doubt, 2020 has been a tumultuous year and has brought unprecedented challenges to our university, deeply impacting communities and families in unforeseeable ways. Yet, we have managed to meet those challenges head on. As an educational and healthcare institution, we have been on the front lines of the pandemic and remained resolute in our mission to improving the health and well-being of Tennesseans. Here are a few highlights of UTHSC's leadership and tireless responses to the COVID-19.
Really early on, we noticed that there was going to be a concern regarding citizens of Memphis and the citizens of our state. We didn't really know a lot about the virus yet. We just knew that it was highly infectious and that the first thing that we needed to do was provide a source of information. So the first thing that we did was we created a website that was meant to be a compilation of information both from UT but from the best sources around the world. We then very soon thereafter translated into Spanish, and I'm proud to say that we were one of the first. So they're really trying to make sure that everybody in our community could have access. The next thing we realized was that there wasn't enough testing. So one of the things we did was we partnered with the city of Memphis to actually develop drive-through testing here in Memphis. We also were worried about the testing. So after you take the nasal swab, where does it go? How does it do that? So we developed our own tests here at UT. And the neat thing about those tests was that they were independent of supply chain. So what that means is when other people were worried about the ability to get nasal swabs and things like that, our test could really use any nasal swab.
Critical in raising our local capacity for COVID-19 tests and making sure results are returned quickly.
Nearly 1/3 of all COVID-19 tests in the city of Memphis come through this UTHSC COVID-19 testing laboratory. Between 600 and 1,000 COVID-19 tests can be processed per day in the UTHSC COVID-19 testing lab, with results returned in less than 12 hours.
We anticipate we're going to be testing, thousands more patients, hundreds of thousands more patients over the coming months.
So now, later along in this pandemic, we're collaborating with industry to bring trials here to Memphis so that folks will have access to the latest in vaccines and drug therapies. So I'm pretty proud of our effort. We've been very fortunate to have such a great team. It's been a tough year, but it's been a year of collaboration. This year has been challenging in more than just COVID. Several incidents with Ahmaud Arbery, George Floyd have really raised what's been a specter over our society for so many years and brought it once again to the forefront.
Hundreds who are members of the Memphis medical community showed their solidarity against racial injustice and police brutality.
In silent solidarity Friday afternoon, hundreds of Memphis students kneeled and paid tribute to George Floyd. One color with one voice. White coats for Black lives.
We're tired. We're frustrated. But we also understand that part of the solution is actually identifying the problem.
And so part of our mission has been to improve social justice by first looking internally and acknowledging that we're not who we want to be yet. I want our college, and I believe institutions of higher learning have to be models and beacons for the rest of the world for who we want to be. And what I want to see us be, and I believe what our entire leadership wants us to be, is a place of kindness, where we welcome anybody. Anybody who has the drive to be here will find a place here. And I want them to feel comfortable here. I want them to feel included. And then I want to take that light from what they learned here or what they brought here, have them bring it out to the rest of the world. And that's our goal.
My name is Edwin Jeffries, and I am a facilities employee. I am the interim director.
My name is Becky Swanson. I'm the financial coordinator here at University of Tennessee College of Medicine in Chattanooga, Tennessee.
My name is Ling Wu. I work as assistant director for research and learning services at the Health Sciences Library at UTHSC.
Hi, I'm Dr. Chandra Alston, the Associate Vice Chancellor for Human Resources.
I'm Dr. James Tudor. I am a professor of pediatrics and a pediatric pulmonologist.
I'm Mustafa Dabous. I'm professor and Associate Dean for Research and also the interim chair for bioscience research.
I would have to say it's the relationships. For me, it is almost like family away from home. The relationship that you build out here on the UTHSC campus is remarkable.
I think it's the people I enjoy most, and I also enjoy, be in the library. We provide services, like research and learning services. So that's the part I really enjoy. Yeah.
I like meeting the different variety of people and different cultures. I also like working with colleagues of various subspecialties. We kind of all work together to try to make these kids well and to help them if we can. Plus I like working at a center where we're high tech and on cutting edge science. Of course we get to teach all levels, medical students, residents and fellows. And so I have seen medical students go into pediatrics that I didn't think would go into that, and I've seen residents who I didn't think would go into pediatric pulmonology come and apply for our fellowship positions. So it's always nice to know that in your teaching that you're not only helping them become better doctors, but also that they want to stay and learn more from you and the other people in your division.
It has been simply amazing. All of the lives that I've been able to touch and those that have been able to touch mine. It's been so rewarding. I've seen so many wonderful things at UT. The campus landscape has changed, and although the people have changed over the years, the warmth and the kindness and the family environment has remained the same. That 20 years went fast, I'll say that for sure. But what I've gained more than anything is a professional presence that I'm really proud of, and a lot of friends and colleagues that I know I have for many years. So it's been wonderful.
Research is my happiness, and I find this a pleasure, and it's really a hobby. So unless you really like it, you're not gonna do well. Also teaching. I love teaching and I love my students. I look at them as my own children. So I'm so much attached to my students.
The most memorable moment for me, the 5 years I've been here, would have to be that moment when the custodial service employees received their certification, and just to see the joy and to see how excited they were was a huge memorable moment for me. The importance of custodial service during the times that we're in is unprecedented. We have to really just take strong measures. Since the pandemic started, we increased our disinfecting process, sanitizing areas, because we wanted to make sure that faculty and staff and students always felt safe. And also our employees, making sure that they felt safe by providing the PPE that they needed. So custodial service right now is very instrumental here on campus during this time. I just want to say to our custodial service, I am just so proud of the work that they are doing. I just would like to say to them to continue the good work, the hard work, their dedication, their commitment. It is definitely not going unnoticed. And I know the faculties and staff, they really appreciate it. So kudos to the custodial services.
I have a lot of those things. You know, when you provide customer service and you got a lot of thank you notes, you know, you're my lifesaver, you know, this is exactly what I need, you know, fabulous job. You know, because clinicians, they are very busy and they just want to find quick answers at the point of care.
Several years ago, I had a little Amish child brought to me that had really bad pneumonia. So we treated the little girl and she got better and was able to leave the hospital. And then a couple of months later, the dad brought a great big huge black garbage bag full of something, and they called me over, and his wife had made a tremendous king-size and a half blanket of Le Bonheur Children's Hospital. So whenever I'm having a low day or something like that, I can look at that and say, well, there are people here that do love me. So, but I was really surprised by that. That was one of the most touching things that I've ever had happen.
Working with the students. I love working with students. And they are the best thing we have. The students and of course my colleagues. I always have a lot of support from my colleagues. Camaraderie here is very, very important. And all my colleagues are very supportive of what you do. You always turn around. You have 10 or 15 helping and ready to help. They drop whatever they do and help.
It is definitely a new normal. It has really brought such an awareness to me to be mindful of my surroundings, to try to assist in every possible way that I can. The adjustment of having to be more flexible, be more adaptable than we were before.
During COVID-19, it's been really stressful, and I say that it seems to be harder to work at home, but UT has allowed us to do this, and I'm so grateful for that. I do miss my co-workers, and as with everyone else, I mean, it's a very stressful time, but I'm grateful that UT has allowed us to, given us this opportunity to work from home.
And I have to tell you, I'm really, really proud of my team and how they've adjusted to COVID-19. Our team has been first responders, I would say, here at UT Health Science Center in terms of making sure we know who has COVID, making sure we isolate those folks, along with our Tim Barton, our safety officer, and Sally Badu, our communications officer, and Dr. Jones, our chief medical officer here on campus. Working in collaboration with people has been important for us during COVID-19. HR is right in the middle of things, making sure we're being good partners and good stewards of the resources that we need for COVID-19. So how have we responded? Wonderfully. HR has been here, and I'm so proud of how responsive we are. I'm so proud of how we've partnered with people, and I'm so proud of the team that I have. It's just an awesome team to be able to lead, and I'm privileged to be able to do that. I feel like I'm lucky that I don't even deserve all these wonderful employees, but I'm grateful that Dr. Brown sees fit for me to lead this team, and also this team will follow me, and we will do the things that are necessary to make this campus great.
You have to love what you're doing. You have to be dedicated to what you're doing. You have to have loyalty. And then stop complaining, roll up your sleeves, and get in action and do what you think is not right and make it right. And keep working. Work as a team, because as a team, you achieve a lot more than you can by yourself. So roll up your sleeves, do whatever it takes to complete the job. This is the key, not just for success and longevity, but also to live a happy life. We spend a lot of time at work, so you've got to enjoy it. You've got to love it, and you've got to be loyal to it so that you can do a good job. And that's the best thing you can do.
As a supervisor myself, here at UT Health Science Center, I think it's important for us to develop other people. It's important for us to create environments where people can feel like they're safe, where they feel like they're heard, where they feel like they're included and their voices are not muted because of who they are or what they represent. It's important for us to pour into them the resources that they need to be successful. Training, development, meeting with them regularly, talking to them, listening to them, really finding out who they are so we can match their skills with the right jobs and tasks that we have here. It's so important for supervisors to be able to develop people, but that comes from caring about people. And you have to have that care and that genuine love and concern for people before you can be a good supervisor. That's the most important thing we need here at UT Health Science Center.
Now we have more emphasis on diversity. And with diversity that UT now is really going very fast, you feel a lot more comfortable, and everybody works in a family-like environment, which really characterizes UT.
I'm very grateful for this position. What UT has to offer, just in benefits and educational opportunities that they allow. It's a great place to work. It's been a great career. My only regret is I didn't find UT sooner.
But I love being in this seat because I get to develop other people, and I just am so grateful that I've been given this opportunity. And if I don't leave anything else, I want to leave a legacy of helping other people, because when that phone rings, I don't say, who is it? It's your cousin. I don't care who it is. If I can help them, I'm going to help them. If my team can help them, we're going to help them. If we have a job that they can go to on this campus, they're coming to that job. That's what this is about in HR, and I want to be that type of leader, and that my legacy to be that type of leader. So UTHSC, thank you so much for giving me this opportunity to sit in this seat at this time, because I know it is my purpose, and I'm grateful for that.
Being a part of the university is great. It's fabulous.
Well, I feel like I wish I was 50 years younger to start it all over again. Why? Because it has been wonderful, and I really would love to start all over again. But they have been happy years, and I still remember every day, every month, every year with happiness and pleasure, enjoying what I have done and continue to do.
It is now my pleasure to introduce the 2020 Service Recognition Honorees.
Medicine and all of the health disciplines are team efforts. We cannot succeed as individuals in anything we do. So to each and every one of you who works so hard on behalf of UT and behalf of all our missions, we're grateful and we're incredibly appreciative. So thank you.
Thank you, honorees, and the entire UTHSC community across Tennessee for tuning in and celebrating together. Until next year, we are UTHSC.
We are.
We are. We are.
We are.
We are UTHSC.
We are UTHSC, and we love it.